Welcome back to part two of our discussion on mastectomy and breast cancer. So if you are diagnosed with a breast cancer and need a mastectomy, your surgeon will counsel you and take you through the extent of the resection, whether you will need to have any lymph nodes in the armpit removed, and whether you will need to have any skin on the breast reconstructed at the same time. And this is separate from breast reconstruction. Sometimes you can do a mastectomy and you can take only the breast tissue, leaving the extra skin that's normally on the breast, and you can close the wound quite simply. Then with a bit more aggressive or a bit more advanced cancer, you often have to take the skin with you, and this can leave a hole in the chest wall, at which point you'd have to move some tissue in there to close the chest wall off. And then, of course, the third question is whether you would need to take any lymph nodes from the armpit. The reason we would take lymph nodes is based on whether there is any evidence of early spread of the cancer to the lymph nodes in the armpit. The lymph nodes in the armpit is the site for the earliest breast cancer spread. And oftentimes, what we find is that if we can get ahead of the cancer, so if the cancer is spreading to the armpits, if we can get ahead of it and get all of those lymph nodes out, we can still get a cure for you. So, where cancer is concerned, if we find the cancer early enough, and by early enough, I mean before it has spread into the rest of the body, it has metastasized. Once a cancer has spread into the rest of the body, either i.e. into your blood, into your lungs, or into your liver, a cure for that is almost impossible. And generally what we look at then is palliative treatment, and we would avoid any surgery, because why would we operate if we weren't able to cure you? It would just be hurting you. So when we do operate on a breast cancer, we generally are operating on people who are otherwise healthy. There is no cancer that has spread. The cancer is limited to the local area. So our main concern becomes managing the cancer in that area and making sure the wounds are healing well. And once that is achieved, we're happy to let you go home. I think the average stay post-mastectomy might be a day or two at the most. Okay, that is another great question. The idea of not having a breast features differently in different people's minds, especially if you have been diagnosed with breast cancer. So if you look at it, okay, if you have breast cancer, the question of when can we reconstruct the cancer, the best time to reconstruct the breast is when we will get a good result. So if we have to cut the breast tissue out and we still have to radiate the area, we would not opt to reconstruct at the same time, because the radiation will destroy or shrink or harden the reconstructed tissue. So what we would then say is have the mastectomy, have the radiation, and come back after a period up to about a year afterwards, where we would then import fresh tissue into the area and reconstruct your breast for you. In some patients where the cancer is caught early enough, and this is very, very important, where the cancer is caught early enough, often we can do something called oncoplastic surgery. And oncoplastic surgery is breast resection or lumpectomy with the goal of actually giving you better looking breasts than you had before the cancer. And this is done through a variety of techniques where we, import tissue into the area. We excise all of the cancerous tissue with a safety margin. We then import tissue into the area and we correct or make the other breast symmetrical. And often these are our most satisfied patients because, having had a diagnosis of breast cancer, and coming to the hospital with all of this anxiety and this fear, finding out that they can get a breast rejuvenating procedure at the same time is often quite uplifting. So the timing of breast cancer reconstruction depends a lot on the stage at which we find the breast cancer. That's the first thing. So we cannot go against the stage of the cancer because that'll determine the treatment of the cancer. And then there's a group of women who, due to either the anxiety or the fear or just, not wanting to have so much surgery, might opt to only have the cancer treated at that time. And then a few years down the line might opt to come back and do a delayed reconstruction. This group, there is nothing wrong with this decision. And this group often does very well with the reconstruction. A lot of them end up opting to not have the reconstruction, which is also okay. But a lot of them do opt to have the reconstruction, and they're often a very, very happy group of women. So the timing of breast cancer reconstruction is dependent, one, on the type of cancer. Sometimes we don't have a choice as to when to reconstruct, and then also on the patient's choices. So yes, that's a great question, Chantal. The question of sensation, traditionally, our goal was always to reconstruct a breast-like shape with not really considering the sensation. The idea was to help the woman look normal in clothing and to feel normal naked in front of their sexual partner. But with time and improvement in techniques, we do find that some surgeons are attaching the thoracodorsal nerve to the nerves in and around the breast to enhance sensation to the reconstructed breast. This is not always successful, but where possible is a goal worth aiming for. In terms of nipple reconstruction, we're actually going in a different way altogether. Whereas previously we used to try and reconstruct the nipple and build a nipple out of the tissue there or thereabout. Sometimes you would steal from the other nipple to use a graft to give you a nipple on the reconstructed site. What we are finding increasingly is that tattooing works best. Modern 3D tattooing gives the appearance of a nipple so well that a lot of women are foregoing surgery for nipple reconstruction and opting instead for nipple tattooing, as this fulfills their self-esteem, fulfills their self-image in the mirror. And if the breast is insensate or doesn't have sensation, then there is no added loss from not having the nipple sensation. I don't know if this makes sense, but what we have seen is that our patients are really going in this direction and are very happy with the results. So in terms of the risks of a breast reconstruction, what we try and do is identify the best reconstructive option for you. And if we look at it broadly, there's two types of breast reconstruction. There's reconstruction with alloplastic tissue or autoplastic tissue. And what this means, alloplastic is where we use foreign materials, implants, and tissue expanders to reconstruct the breast, whereas autoplastic is where we use your own tissue. And in terms of using your own tissue, what we tend to do is we look at two areas in the body. We look at the lower tummy area, because often we find a nice combination of muscle and fat, enough fat to be able to make a breast mound. We then transfer that tissue to the breast to make you a new breast, or we take the muscle from the back and swing it to the front to make you a new breast. Those two reconstructions, we would choose the appropriate one depending on your comorbid conditions. So for example, someone with diabetes or high blood pressure or who is a smoker might be a better option for the latissimus dorsi reconstruction rather than the tram reconstruction, which uses the tummy fat, because that often doesn't survive in people who have other vascular problems. So your surgeon will match the reconstruction to suit the best chance of you getting a good outcome. And I think that that's how most plastic surgeons would practice. I think that's a very tough question. I think the diagnosis of breast cancer is very anxiety inducing. You know, it makes you question your femininity. It makes you question the future. It makes you question your longevity. It makes you question so many things. So I don't know how I can tell someone to prepare themselves for that. What we try and do is support you through it, and we encourage your family also to support you through it. Often the best people to talk to in any situation are people who have been through a similar situation before. So we encourage the use of breast cancer support groups, mastectomy support groups, reconstructive support groups a lot.